Welcome to The Explainer. Today, we're jumping into a traditional belief system with its own very unique answers for infertility. We're going to explore its core ideas, the specific symptoms it looks for, and the really hands-on remedies it prescribes. This is all based on a popular guide for women who are trying to conceive, so let's get right into it.
So, right off the bat, we've got this question. Can a uterus actually catch a cold? Now, that might sound a little weird to us, in our modern world, but in the system we're exploring today, the answer is a definite yes. And this cold isn't just a small problem. It's seen as one of the biggest roadblocks to getting pregnant. Let's find out why. Okay, so let's start with the main diagnosis, the absolute foundation of this whole thing, a uterus with cold air. According to our source, this is the root problem, the thing you have to fix before you can even think about anything else. So, what exactly is Buruda wa Hawa? Well, it describes the state where the uterus is just not warm enough. The idea is that this internal cold creates this, really unwelcoming environment that makes it tough for sperm to survive its journey and pretty much impossible for pregnancy to actually take hold. Now, this whole idea of a cold uterus is almost always connected to a second, more physical issue, what the source calls a fallen uterus. And this isn't about temperature anymore. We're talking about the actual physical position of the organ itself.
The source calls this Nuzul al-Rahim, and it's seen as a huge mechanical problem. So you've kind of got this 1-2 punch, right? The belief is that the uterine environment is way too cold, and the organ itself is physically out of whack, creating this double barrier to getting pregnant.
So you're probably wondering, okay, how would anyone even know they have this? Well, the source gives a whole list of really specific symptoms to look out for. We're talking about everything from pain or even weird gurgling sounds during sex to really noticeable changes in your period, like dark, clotted blood. And it even includes urinary issues, like feeling pressure or a slow stream, which is thought to happen because the uterus is literally pressing down on the bladder.
This slide right here really breaks down the mechanical logic perfectly. You can see it in the diagram. The whole argument is that a uterus that's sitting too low creates a physical roadblock. So, step 1, the uterus is too low. Step 2, semen is deposited. But then, and this is the key part, step 3, because of that low position, it just gets expelled. It can't travel up. So, from a purely mechanical point of view, pregnancy is just not going to happen.
All right, so now that we've got the problems laid out, the coldness and the fallen uterus, the next logical step is, what do you do about it? Well, the source moves right on to the remedies. Let's dig into this whole catalog of treatments, which are all about bringing back warmth and getting everything back in its proper position.
And there are tons of herbs on the list, but what's really interesting is that you're not just supposed to drink them as tea. The source talks about using them in all kinds of ways, in washes, as steam baths, and even in these topical poultices. The whole goal is to deliver that warmth as directly as possible.
And the instructions get super specific, as you can see with this method for an herbal poultice. You boil the herbs, strain them, and then you actually stuff the boiled herbs inside a sanitary pad. The thinking is that by wearing this warm, herbal compress for a few hours, it will literally pull the Buruda, that coldness, right out of your body. And listen to how powerful this claim is. The source says this with so much confidence. This onion and wormwood poultice isn't just a warming pad. It's presented as this amazing cure-all that can literally pull out everything, the cold, the air, and even infections. And the list just keeps going. It's not just about poultices. The source also recommends things like eating raw garlic cloves, putting warm castor oil packs on your abdomen over your ovaries, and using herbal steam baths to really let that warmth soak into your body.
But maybe the most hands-on, the most direct treatment described is the physical manipulation of the uterus itself. So we're moving beyond just warming the body and into actual manual correction.
This practice, al-Rahim, is presented as an absolutely crucial step to fix that fallen uterus. The source even flags certain activities, like swimming, as something that can introduce cold and make the uterus drop, which means it then needs to be physically lifted back into place. Okay, and this brings us to what I think is a really fascinating part of all this, where the source creates this stark contrast between this entire traditional approach and the world of modern medicine.
This table really spells out the huge difference in how they see things. On one side, you've got the traditional midwife, the Daya, who's valued for her hands-on knowledge, her ability to literally feel for a fallen uterus or cysts and then physically fix it. And then on the other side, you have the doctor, who uses technology, like an ultrasound, to see what's going on, but in this view at least, doesn't offer that same kind of hands-on physical correction.
And that's really the heart of the argument right there. It's all about this perceived gap in care. The Daya is shown as someone who gives you an immediate physical solution. She says, let's fix it. And she does. From this perspective, modern medicine might tell you what's wrong, but it doesn't give you that direct manual intervention to fix it right then and there.
So really, what we've seen is a peek into one very specific, very detailed belief system. But it leaves us with a much bigger question, one that a lot of us face in all kinds of ways. When you have tradition and modern medicine giving you completely different stories and different solutions for the same problem, how do you figure out your own path to getting well?